So health psychology, typically we think of it as having two main strands. One is really about health promotion, where there's health psychologists who work out more in the public health arena, where they're trying to encourage people to adopt better and more healthy lifestyles. So things like wearing seatbelts in cars, things like wearing crash helmets on bikes, things like stopping smoking are all the realms of psychologists who work in the area of health and health promotion. Then the other area is where we're really talking about managing health conditions or working with people who've got health problems. And so health psychologists work with people with a variety of problems, from children with childhood difficulties like cystic fibrosis and things like this, all the way through to adults that may have type 1, type 2 diabetes. And what a health psychologist can do is help people make sense of their illness, can help them sort of learn a little bit more about how to cope with their illness, how to not just cope with sort of some of the psychological consequences of perhaps having a chronic health problem like anxiety or depression, but also to help them learn how to do things like manage some of their symptoms better, manage their pain better, for example, live a better quality of life despite having a chronic illness. So for people who've got chronic health problems, whether it's chronic pain, whether they've got a chronic illness like rheumatism or arthritis, whether they've got chronic lung disease or heart disease problems or diabetes, psychologists can help. They can help individuals make sense of what's going on. They can help them understand the sort of emotional consequences of those problems that they've got. But they can also help them to change their lifestyle. So they can help them to learn to adapt to the illness, to adjust to it, to modify the sort of way that they may interact, if you like, with their health problems, so that they can actually live a better quality of life. And so that doesn't mean that everybody who's got a health problem will have psychological problems too. But there's often some anxiety, some depression, even if they're mild symptoms that go along with chronic health disease and chronic health problems, and psychologists can help with that. Lots of the health psychologists in Australia are really good researchers, and the research that we do in health psychology is really important in terms of trying to understand those mechanisms that allow people to adapt and adjust to chronic illness, those sorts of psychological factors that allow people to take up healthy lifestyles in the first place.
In health psychology, we're particularly interested in the interface between people's physical health and other aspects like their mental health and behaviour and wellbeing. So we look at that intersection in the sense of how we can help prevent health conditions from developing, or help people to manage their health, and also helping them deal with some of the changes and perhaps emotional stresses and things like that that can come along with managing a health condition.